Hey, this is Andy from Stansfield Health and Life. You probably found this video because either you or perhaps a relative, a friend, is coming up on Medicare eligibility. Typically, that means you're about to turn 65, but in some cases, if you've been on disability for 2 years or more, they will automatically give you Medicare as well. So this is the standard presentation I go over with every single person I meet with when it comes to Medicare. I find that the definitions and the words used in Medicare and the costs are all very, very confusing for people. And so far, the government's only been able to put together about a 200-page booklet on it. So I do everything I can to condense it into kind of one little sheet of paper. I call it my Medicare 101 bar napkin presentation. This should just get you a little bit up to speed on what Medicare is, what it pays for, and how to look for options out there that will help you pay for any Medicare costs that are not paid for through the government. Without further ado, move on to the video here, and I hope you get something from this. Thanks.
So let's get started. The first thing we're going to look at is your red, white, and blue card. This is where most people will start off with Medicare. On your red, white, and blue card, you're going to see something mentioned about Part A and Part B of Medicare. These two different parts together consist of what's called original Medicare. So when you look at Part A on there says hospital. That essentially just means hospital stays. A lot of times an easier way to think about it are services that you receive on an overnight basis. Services you receive overnight are usually charged to Part A of Medicare, and then if there's anything additional for you to pay after Part A pays their portion, then you'll be assessed that as well. Part B says medical on your card. This is simply, think of things that you do in the same day, like a doctor visit or a lab or an x-ray. Things that are done in the same day are usually paid for by Part B. And this is what everybody starts off with original Medicare. And just like any insurance plan, this is a government insurance plan. So there are going to be some costs involved with that, and I'm going to get into those right now. The first thing to look at is something called a monthly premium. That is the amount of money that you would pay on a monthly basis in order to have Part A and Part B. There's actually two different premiums. Part A typically has a premium unless you have worked in the United States and paid Medicare taxes, which is the vast majority of people out there. So if you've done that throughout your lifetime, paid Medicare taxes, then your Part A is what's called premium free. Part B, however, your doctor visit portion of Medicare, does have a cost. On average here in 2020, it's about $170. It might be $170 and a few cents there, but on average about $170. This is for the vast majority of people on Medicare in this country. If for any reason your income 2 years prior to joining Medicare was significantly higher than some of the averages, then you may see them assess you what's called an IRMA, which essentially is an income-related adjustment, and they will charge a little bit more than $170. But I would say about 90% of the country is all paying $170 on a monthly basis. So looking at some of the other costs involved, we're going to kind of move over here real quick, and I'll set up something. So when we're looking at Part A and Part B, outside of the monthly cost for Part B, there are some other costs involved with Part A and Part B. So let's start with Part A, your overnight charges, your hospitalization charges. Part A comes with something called a deductible, not unusual for most insurance plans. But in this case, there is a deductible. It's about $1,556 here in 2022. That is your deductible, meaning that the first amount of money for any sort of overnight or hospitalization stay would be charged to you until you reach $1,556. What this does is it opens up a window of care between 1 and 60 days. So once you've met your deductible, you say you pay deductible. Everything else within that 1 to 60 day period is paid for by Medicare Part A if you're in the hospital. If for some reason that amount of time goes even further, between 61 and 90 days, now this is where Medicare comes back and says you have to pay a little bit more per day. In this case, in 2022, it's about $389 per day, every day after that 60th day that you're in the hospital. Gets a little crazier from there. If you're between 91 and 150 days during the year, they bump that to about $778 per day if you're hospitalized. And then after 150 days, which does not happen all the time, but it certainly can happen, this is what's called uncovered, meaning that Medicare has now stopped paying any portion, and any hospital charges would be completely up to you. This is essentially where Medicare will stop in their assistance, is after 150 days in the hospital. If we're looking at Part B, there is also a deductible. In 2022, that deductible was $233. So the first $233 of charges in a same-day fashion, your doctor visits, your labs, your x-rays, that will be up to you. That is the deductible. After you reach the deductible for that year, Medicare then switches over to what's called the 80-20 split. Most people know this about Medicare. They usually say it's about 20% to me. So that's 80% paid for by Medicare, 20% paid for by you. So here's where we're at. Here is what original Medicare is all about. It is Part A and Part B. And so you don't have to do anything more about more for this to have Medicare. This is essentially what everybody starts off with when it comes to Medicare. However, most people do want to know how to deal with different costs like this, and this, the deductibles and other types of costs out there. So there are a couple of different options we can go with. Let me just squeeze out a little bit here and move over. A couple different options we're going to go with here would be, one, going out and purchasing a individual policy. This is called a Medicare supplement. Others call it Medigap. And essentially what this is this going out to a private company and purchasing a policy that you pay for on a monthly basis. In fact, I usually call this the prepay path of doing things. You're going to purchase a Medicare supplement, and what the Medicare supplement will do is pay for any additional costs that Medicare doesn't pay for. For instance, this, and over here, and oftentimes the 20%. What you are doing is you are paying a flat amount per month to have that ability. Typically, when you turn 65, these plans are about $200 per month. So that would be one way of taking care of all these additional costs over here associated with Medicare. Now, something we did not talk about are drug plans and drugs. That's actually something that's it's separate from from your Medicare supplement, and you would have to go and get something called a Part D plan. Part D, I think D for drugs is the easiest way to do that. Part D plans come in a number of different costs, and usually those costs are all dependent on the specific types of medications that you personally take. These I've seen range in price anywhere from $7 a month all the way up to about $80 per month, just depending on the specific medications. So what we would do is, looking for the best Part D plan for you would be to take a look at what sort of medications you're on and run it through the system to find out which plans out there would cover that medication at the lowest possible cost for you. So it will be a monthly amount, and then after that you would have just small co-pays associated with your medications. So all in all, this whole path right here, the prepay path, is because you are spending a certain amount per month to have coverage, but you're not ever asked for anything outside of that. Essentially, you're prepaying all of your healthcare expenses every single month, whether or not you go to the doctor. So that's the Medicare supplement, or the prepay side. But there's a lot of people that just say, hey, I don't want to spend $200 a month. I'm a pretty healthy person. I don't necessarily think I need that amount of coverage because I rarely go see the doctor. There's all sorts of other reasons for why people would look at other options. And here's the other option. This particular way I call pay as you go. Just like this. And what that means is, going pay as you go is you're going to go and look for an option called a Medicare Advantage plan, also called Part C of Medicare. I like to call it Part C. I think of combo or combination, because a Medicare Advantage plan is simply a private insurance company that has created an insurance plan of their own that will do any service Part A will do. It will do any service Part B will do. And in most cases, it will include a Part D drug plan as well. In many, many cases, the monthly cost to have a plan like that is actually $0 per month. But you are going to be paying something, and where is that? So remember, on the left side over here, on the Medicare supplement side, you are prepaying every single month, whether you see a doctor or not. In the Medicare Advantage world, what you're doing is you are not paying anything per month. However, when you do go to see a doctor, you will pay a copay to see that doctor. You'll pay a copay when you go to a hospital. You'll pay a copay when picking up your medications. So everything has a specific copay attached to it, which means that all of these prices over here are now out the window. Now all you're going to do is focus on whatever pricing that this particular Medicare Advantage plan has. And when you're evaluating Medicare Advantage plans, you can look back and forth between one company and another to see what it is that they charge for things like doctor visits, hospital stays, labs, x-rays, and so forth, and see what might be the best fit for you. A Medicare Advantage plan comes in two distinct flavors. If you've ever worked a corporate job, then you may have seen these terms before. Advantage plans will come in the form of an HMO or a PPO. An HMO is what's called a health maintenance organization. This is essentially run by your primary care provider, and that primary care provider will give you referrals to see different specialists and have certain procedures done. If you do not have a referral, you cannot go see that particular specialist, and all of the doctors within an HMO work within a network. Those are the big things to remember about an HMO. On a PPO, there are no referrals needed. If you need to make an appointment with a particular specialist, you can just call that particular specialist and go in and see them for the appointment. How much you pay for that appointment varies depending on whether you are in or out of network. So just like an HMO, they do have a network and a PPO. You're just not required to stay within that network. However, they do make it worth your while because in-network costs are always going to be much lower than going out of network. But it does give you the flexibility if you need to see providers that are outside of an HMO's network. You can look at doing a PPO and seeing if that might fit your needs better. So then that we've seen all the different ways of handling Medicare and their costs, what is the next thing to do? Well, the next thing to do is to ask yourself a number of questions, and this is something we can go over in an appointment. First is, which path is best for you? Most of the times what this takes is looking at about how often you are using your own health care. Take a look at how many times you see a primary care doctor. How many times do you typically see a specialist? How often do you go to the hospital? And what sort of medications are you on? All of these will factor into determining the best path for you and your particular needs, and that's what I'm here to help go through. After that, let's say you've selected a path. Now it's up to me to go find you. Let's find all the best options. In that path. And that's really all it is that we do. We go find the best options that are available in the path that you choose based on your usage of healthcare, your comfort level, and just what you feel like working with when it comes to the world of Medicare. So hopefully that helped a little bit. If I can be of any assistance, please contact me whenever you can. My name is Andy Stansfield with Stansfield Health and Life.